generally, if it's a sharpness or a catching type of pain, it might be more of a compression or a lack of movement, a movement restriction. If it's an aching pain or a night pain, there's more likely to be an inflammation.
Hi, and welcome to Shift with Shubra. I am your host, Shubra Venetti. I am a certified sleep consultant for adults and children. I'm also a baby science program instructor and an Akashic light healing practitioner. And on Shift with Shubra, we have conversations with different health and wellness practitioners, digging deep into conversations that nourish our mind, body, and soul. And on today's episode, we will be talking about physiotherapy. To talk about physiotherapy, we have Melanie Miers, and Melanie is a physiotherapist based in Hong Kong with Physiomotion. Mel and I have known each other for more than 10 years, and I'm so happy that she's come on today's show to talk about physiotherapy and also her subspecialty as a lactation pain specialist physiotherapist. And she's going to be talking about what that is and how that's different from a lactation consultant, and when you would want to go see a lactation pain specialist, and also about physiotherapy in general and when you should go see a physiotherapist. We're going to talk about pain a little bit. Is it acceptable to just live with pain? The short answer is no, but tune into today's episode to learn a little bit more, and I hope you enjoyed today's content. Please subscribe to our channel, like the episode, share it with people that you think would benefit from this conversation. If you have suggestions for upcoming episodes, do write into us. Our contact details are in the show notes below. So I hope you enjoyed today's episode, and thank you so much for tuning in. Hi, Mel. Thank you so much for coming on Shift with Shubra. And I would just like to really kick things off. You are a physiotherapist. You're also you have so many qualifications now, but you're basically Pilates instructor, physiotherapist, and also a lactation pain specialist. And I was just wondering, one, if you could maybe share your journey on how you became a physiotherapist and then also a lactation pain specialist and what that is, especially
Yeah.
as well.
Yeah, well, thank you for having me. It's a pleasure to speak with you. Um, I was a very odd 13-year-old child who actually learned that she wanted to become a physiotherapist through playing netball. So
Okay.
through sport, which is very commonly how people first become exposed to maybe the profession of physiotherapy. Um, and I was playing netball in a tournament, and there happened to be a physiotherapist there. I'm not quite sure why at that age, but they were. And I'd sprained my ankle, and we had to play the next day. And she was able to give me the right advice, a little bit of strapping, some advice as to how to get myself through the next 24 hours so I could then play the next day. And I was able to play the next day, and I was amazed, and I was like, wow, I want to be her. So that was really my introduction to the profession of physiotherapy, and also wanted to always be able to help people and educate people.
Mm.
And that's how I came about physiotherapy, really. When it came to the lactation pain specialist, the clinic that I work for in Hong Kong is called Physiomotion, and we deal with a lot of women's health issues. And we were dealing with people prenatally, and then we were seeing them postnatally. And then, so we were helping them with their incontinence issues or their pelvic pain or low back pain issues. And then also, a lot of them would have to cancel their treatment because they would have breast pain. And we were like, surely there's something that we can do for this. Physios deal with inflammation, we deal with getting rid of pain. So we decided that we'd look into, where to train, to how do you treat lactating breast pain.
Mm.
So I went down to Australia, and I trained in Australia, and that was about 6 or 7 years ago now. So we're building the business and building Hong Kong's education about the service that we offer, and it's going really well.
That's amazing. Okay, congratulations on that. Tell me a little bit more then. I mean, we'll come to lactation pain in a second then again, but if we could just break down physiotherapy, I think most people kind of probably have, or either they know or they know someone who has obviously maybe sprained an ankle, twisted an ankle, or has broken a limb or a bone basically, and has to heal a limb. But what is physiotherapy really? What's the history of the discipline? What is its function? And do you only go to see a physiotherapist if you have to repair something, essentially?
Okay, so the origins of physiotherapy dates back for many, many years, specializing in re-establishing optimal movement, strength, and function of individuals who are usually suffering with an illness, an injury, or a disability of some sort. And its main aim is to promote the quality of life. Um, it was first practiced as far back as 1400 BC, all right, from physicians of Hippocrates and Galen, who were seen to use manual therapy techniques, massage therapy, exercise therapy, and hydrotherapy methods to treat their patients.
Okay.
So moving on from its historic roots, physiotherapy developed as a much more scientifically based treatment approach. It became a licensed and registered profession where you aren't allowed to practice physiotherapy unless you have qualifications from a registered institute. As part of the licensing of a registered physiotherapist, a strong ethical code of conduct upholding its members to adhere to. All right, so it's to this day, physiotherapy is a licensed and regulated profession. Okay, but in essence, physiotherapy has a long-standing history, and its roots lie in healthy musculoskeletal and physical performance. All right, so it's evolved greatly since its origins, and now it encompasses many other subspecialties ranging from cardiothoracic, neurological, pediatric, just to name a few. So physio's ultimate philosophy is to enhance health in all its facets.
Right. Okay. Because I mean, I guess most people are sort of under the impression that physiotherapy is just more about rehabilitation.
Right.
Is it more than just rehabilitation? Like, yeah.
So I guess this comes down to the question of how we look at joints and muscles and
Yes.
the functionality of the body. Um, and really what we're looking for in physiotherapy is to accurately diagnose based on strong assessment skills, which is imperative to treat the underlying cause of the patient's symptoms. Right. So we focus on manual therapy. So it's a hands-on technique combined with a targeted exercise program to the region of the body needing that optimal therapy or treatment, or to get the synergies and the movements and the strengths all working optimally together. We take on a very holistic approach. So
Okay.
we look at the whole body. All right. So we are naturally looking specifically at each region of the body. All right. And this allows us to address the dysfunction of the body, whether the origins are joints, neural structures, muscles, or any other soft tissue within the body. So it's not necessarily, as you described it, as rehabilitation. Yes, we are always rehabilitating, but the fact is that we need to make sure that we've got the cause of the pain our main focus.
Okay.
So the body is so interconnected, and it's often very difficult to dissociate body regions as one primary cause of pain.
Yeah.
Right? So generally speaking, acute injuries mainly require like initial treatment in the area of treatment of the injury, but anything that is more chronic usually requires addressing multiple regions. So the key is to understand the interplay between these key regions. All right.
Yeah. And I think that because most people are probably familiar, like, oh, if I get into an accident, I'll go over and I'll just. Do people walk into physiotherapists for any other reasons besides rehabilitation? Like, what else
Yeah.
can they go to a physiotherapist for?
Well, so we typically the main concern or complaint that people would come in for physiotherapy is if they're in some form of pain.
Right.
So if someone, often what we need to get an understanding of is what that patient wants out of their physiotherapy. The fact that they've even come to physiotherapy often explains that they have consent and they're looking for help of some sort. So So sometimes we get people that come in and they are more and more aware that their posture may be not quite right. And we rejoice in this when someone actually walks into the clinic without pain. It's like, well, good for you. You're actually empowering yourself to stop that pain from potentially being the issue.
Mm.
So yeah, that's very uncommon, actually. I mean, it's nice to see when it does happen, but really, the main cause for people for seeking physiotherapy would be pain, stiffness in their body, some form of neurological tingling or numbness, a restriction of movement are usually the main causes for people to seek treatment.
Right. And so when you talk about, because we talked about alignment as well, um, and we also talked about specifically pain regions, would, because I know that you are, you do also a sub, not, you've done a training specifically in connect therapy, and I think that's really interesting because I was being obviously a patient of yours for so many years as well. I was very fascinated that for an issue that would have been in part of my, I don't know, back, that somehow or somewhere in my lower back, it was related to, I don't know, my feet or my knees, or it was related to my neck or something like that.
Yeah.
Can you I don't know if it's possible, but could you explain? I mean, because people have to understand also what functionality of movement is. I think in general, since our whole lifestyle now is very sedentary, right? Like we sit at a laptop and that's our functional movement. I have to sit for long periods of hours.
Yeah.
So maybe we can break down two parts of this question. One is, what is functionality? Like, what is optimal functionality for our body actually? Like, what should people be considering as functional movement? And then, how is it that, from your angle as a physiotherapist, that you would look at the body? Like, how are different parts of the body connected to different parts, if that makes sense? Because
Yeah.
I think people just think of it as isolated parts, and they don't think, oh, your neck might be actually related to your foot.
Yeah, absolutely. So functionality, if we're going to put a definition to functionality, it would be just optimal movement where your body is able to absorb the shocks of your activities of daily living, putting minimal stress through the areas of the body, posturally, actively, and also being strong enough to withstand the stresses that are put through it on a day-to-day basis, whether that's sitting at a desk all day long, or whether that's going out to hike the hills or play rugby, for instance. So your functionality from person to person is very, very different, obviously, depending on what is necessary. So a new mum requires a lot of very different movement strategies that they may not have needed. And also they've just had a pregnancy, which will have probably 99% of the time weakened their system somewhat. All right. So the most important part of our treatment, when someone comes into our clinic, the assessment aims to find the source of the pain, of the dysfunction that the patient is presenting with. And this is where Physiomotion particularly believes that the assessment and a firm working diagnosis is of utmost importance to effectively treat that patient's needs. We often call this finding the driver of their pain. All right, so this is also a connect therapy term, but not wanting to talk too much about the connect therapy, but this will make the treatment much more effective and result in faster pain relief. All right, so often where the pain presents itself is not the only or the actual structure that is causing the problem. For example, if you have a knee pain, all right, commonly the other regions of your body are actually causing the poor loading biomechanics through the joint. And that is what is actually causing the pain. So we try not to hone in on that one area that's causing the problem. So let's say if you lean to one side posturally due to a mild scoliosis, which is a curve in the spine, and that in turn causes a rotational torque in the knee. This can cause the pain and the loading, the non-optimal loading of the knee joint. Okay, so in this case, the knee pain will only resolve if whatever is causing the scoliosis is actually addressed. So in this example, we aim to get to the root cause of the knee pain rather than just treating the symptom.
Mm. Yeah. Okay. Yes. I mean, so that's so with the curvature of the spine, obviously, is affecting the alignment of how the knee is sitting. So instead of this knee sitting like this, one is actually turning out because of the curvature of the spine. And so, in terms of your assessment, how do you guys usually assess when you're looking at an assessment of a person?
Yeah,
What are you
so we
assessing?
go through the regions of the body, and we will do a movement analysis. So a structural movement analysis, which involves a series of tests, and they're pretty standard to begin with until we find a non-optimal strategy or something that's going off what we call a non-optimal movement, that's actually loading the body in what we feel is not helpful.
Mm,
So we will note that particular area of the body down, and then we will continue through our movement strategies and see where else that is causing a non-optimal strategy. And then we look at the interplay between those key regions of the body and see if we correct one area, does it offload the other or does it make it worse? And then we will obviously only treat the areas that make the pain or the symptom or the non-optimal movement strategy. Is quite difficult to sort of maybe not always hone in on the symptom, but look
mm.
where the dysfunction is actually happening and where in the movement that dysfunction is actually happening.
Right. Okay. So if we can give some examples, for example, in the clinic also you work with people with migraines and headaches, if I remember correctly, as
That's
well,
right.
right? And
Yeah.
how, I mean, obviously, besides taking a Panadol or a paracetamol or putting some, I don't know, like some herbal sort of like tingly mentholy type medicine on your forehead, your Kwang Long and your axe oils or your white flower oil, what exactly would you be looking for in a physiotherapy angle that's causing the migraine?
Well, again, it comes down to where through the body is causing that unnecessary or non-optimal torque in the body that's loading up potentially the neck, which is shutting down the blood supply or the nerve supply to the head. So again,
Mm,
it comes down to looking at the feet, maybe how the feet, because that's one foundation that we stand on. The other main foundation would be the pelvis. How is that sitting, and loading up the rest of your spine that's sitting on this pelvis that may be in some abnormal torque. Then we
mm,
also look at the rib cage and the thoracic rib cage, which is the area of our body that should be able to be quite mobile and be able to absorb the shock. And if that's
mm.
not, if that's very, very compressed and also twisted because of massive muscle torque, then that again is going to eventually overload the neck joints and
Right.
that sitting.
Right. So it's really about the alignment of like stacking it almost like blocks. Like if one sort
Yeah,
of is out.
that word stacking, and that's a word we use very, very commonly to explain to patients that we want our body to stack evenly and optimally through from the bottom up or from the top down, whichever
Mm,
angle is necessary to be taken for that individual.
yeah, okay. So what are the common issues then that most people have that are probably loading with they're unconsciously loading and they don't realize? Like just maybe like two or three common examples.
So, for example, if you have low back pain, all right, and we're looking at uh, how we want to have a look to see how that back is moving. So we look at how the feet may be moving to absorb the shock that then translates up through the spine. All right. So another thing, sorry, maybe a better example would be if you have anterior knee pain. All right. So we're looking at the biomechanics of that. Um, this condition often is caused by a compression of the kneecap against the femoral upper thigh bone,
Mm,
and it should sit within the femoral groove.
right.
Now,
Yeah. In the
often
middle. Hmm.
structural alignment of maybe the pelvis or the spine, including the thorax and the rib cage, is not symmetrical. All right. So again, it results in non-optimal biomechanics through that knee joint, causing the muscles to maybe pull, in one direction more than another. All right. And likewise the foot as well. If you've got a foot that's either very, very compressed, one of the functions of the foot is to absorb shock, right? So if it's very, very compressed and it's not allowing that shock absorption capacity, it will come up and stress that knee joint more than it would do normally.
Right. And I think that's the another thing is like obviously people standing in just like, but either I can't even remember, is it kyphosis and lordosis, and
Yeah,
essentially like where their pelvis is shifted so forward,
yeah,
or they're standing but they're slumping like this,
yeah,
and
yeah.
all of those put various pressures on the joint.
Yeah,
Yeah.
absolutely. Yeah, and then we're not optimizing our access to our postural muscles either.
Mm.
So, which are fundamental to us loading our joints correctly. If we don't have those postural muscles in the background, then we will overuse our movement muscles, which put added stresses and strains. And
Yeah.
then we learn that movement strategy as being normal when really it's non-optimal.
Now I was just wondering if we can talk about pain really quickly, because I think many people don't pay attention to pain in the right way. What is the definition of pain to you in the body? Like if people were to like be intuitive with their body when it comes to pain, what should they be paying attention to?
Yeah, that's a really good question. It's amazing how much pain people think is normal.
Yes.
And we get people coming into the clinic, and obviously we want to know how chronic an issue might be. So we say, so how long has this been going on for? And it's amazing the number of people that will come in and say, oh, a few weeks, oh, probably actually more like 4 or 5 months. And you're like, wow. So you've been living with this, you've been
Yes.
living with this for that long, and now it's just normal for them.
Mm.
So pain is a very subjective thing. And obviously, different personalities, different people can deal with different levels of pain as well. So you might have someone that comes in and they've thankfully only had something, occurring for maybe 2 or 3 weeks. And we're like, yes, maybe we can, if we're in pain, what our body will try and do is move away from the pain. And so our body will probably more likely cause more problems.
Yeah.
So we have more of an issue of trying to find out what's going on with the initial. Again, it comes back to what is the driver of the pain source, which is far harder when it's a chronic issue.
Yeah.
If it's an acute issue and someone's just walked down the street and sprained their ankle, then obviously it's a much more easier situation. There's been a trauma, there's been an incident. That's more likely the problem if there was a wobbly slat in the road or something, or so pain is a very difficult thing, and what to sort of put a definition to. So people describe pain in very different ways as well. So what we often use is we'll use a visual analog scale. So from a pain scale from 0 to 10. And this gives us a subjective marker and an objective marker. So it's subjective for the patient, but it's subjective for us. So we can tell where our treatment is going. So if Mr. Jones comes into the clinic and he's got a pain scale of 9 out of 10, and 3 sessions later, he's actually said, well, actually, when you think about it, it is actually down to about a 5. People come in and they're like, oh, it's still really bad. It's still really bad. So it helps us put into perspective, and then to put into perspective if we're getting better or not.
And then what kinds of pains are there, if that makes sense? Because I keep hearing neural pain, and then there's stiffness, and then there's inflammation. It's like, can you tell the difference, or they're all sort of related in a way?
And again, it comes down to subjectively how people want to, a lot of people like to describe things as a sourness. What's a sourness? Is it a sharp pain? Is it an achy pain? Is it a neural sort of burning sensation, a tingling, a numbness? So when we question people, they're like, oh, I haven't really thought about the pain in so much detail. But what we're trying to find out as well, what we can try and ascertain from some of the pain symptoms that they're feeling is maybe what structure, not always, but what structure might be the underlying cause.
Right. So if it's something that's sharp, is that possibly that something is tight. But if it's
Yeah,
achy,
more like
then
an
that's
inflammation
inflammation.
type of. Yes, I mean let's be very broad here.
Yeah.
But generally, if it's a sharpness or a catching type of pain, it might be more of a compression or a lack of movement, a movement restriction. If it's an aching pain or a night pain, there's more likely to be an inflammation, as you said. So yeah,
And
so
then tingly
let's
means,
usually some kind of neural compromise.
yeah, something pressing on a nerve somewhere here. And that's kind of what I'm, yeah, okay. So that at least people start to understand, like, oh, maybe if I'm just like sharp, if it's just only centrally located and it's very, it's only a small point, then it's probably the stiffness or
Yeah.
the joints of some kind. So essentially, I mean, in physiotherapy, obviously you guys do a lot of releasing, right? And I think maybe just for people to understand the difference is like, how would you differ from a massage therapist and a personal trainer? Because I think you're kind of in between both, but even more so. Obviously, I'm not putting you, you're a lot more in tuned, but is it a combination of both and more?
So a massage therapist is obviously a massage therapist. They're a soft tissue specialist, and many people can get many results and relief from seeing just a massage therapist. However, as we've explained, the body is very interconnected, and understanding the interplay between the joints, the neural, and the soft tissue. Very often, it's not just one structure that is involved. So yes, the massage therapy may give you some pain relief and obviously allow you to move better, but what is causing that ultimately? And that's what we as physiotherapists would look at.
Mm.
Um, and then on the flip side of that, the personal trainer would be looking more at quality of movement, we hope, as how their client is performing the movement, but also their main focus is about strength, because that's their job is to, they're looking more at strength and conditioning. Their treatments, treatments is probably, maybe that's not the right word, but their sessions are much less hands-on.
Mm.
Whereas physiotherapy and massage therapy is a very much hands-on profession. We
Mm.
want to feel what's going on with our hands. We want to see what's going on as well, but we are a very much a manual profession.
Right. So in the actual sessions, for example, there will be some manual therapy, so some massage. What other things can people usually expect in physiotherapies? I'm sure there's a lot, but maybe like 5 things.
So what we're looking for is we are looking to educate the individual about their condition. So obviously it's not just a case of just being a complete passive recipient of this manual therapy. We want to explain, and often, what they're going to then do for the next 23 hours of their day is paramount to them sort of carrying on and the treatment hopefully having maximal effect.
Mm.
So education of their condition and why they're experiencing the symptoms that they're experiencing. We will also hopefully get to a point in their treatment where we can add a targeted exercise program. All right, so we're aiming to improve the musculo-neural component to the underlying issue so that they can gain strength. And again, it comes down to promoting the quality of their life, all right, to make sure that they are moving optimally, they are strong in that movement, they can feed back to themselves when they're doing something incorrectly and they're going to cause the problem to recur again.
Okay. And if we can now just turn that into like the lactation side of things, the lactation pain of side of things, how can, I mean, in this particular specialty, how what is a treatment looking like? How are you assessing? What are you treating? And then is there other things that women can already do, so new moms that are probably listening to this, that they can already do to prevent that the pain from coming?
Yeah. So first and foremost, what I'd like to say is that physiotherapy and lactation consultants work really nicely together. So we do very, very different treatments. All right. I'm not taking away from the lactation consultants' experience. Obviously, they are the ones that are teaching the mum how to get the baby latched on properly. That is of the most importance, is getting that right, because that's a whole reason why, or a lot of the time is the reason why mums end up having breastfeeding issues. Other than the initial milk establishment and engorgement, anywhere down the line, women can have issues with breastfeeding pain. And it can be anyone that has experienced a blocked duct or mastalgia in any way will understand and can vouch for it being extremely painful and very distressing. And if you've got a young baby and breastfeeding is your only option to feed this child, then it's very, very stressful to an already very, very vulnerable mum. So from my point of view, when a lady will come in with breast pain, what we are trying to understand is, and often can't necessarily diagnose, is whether it's a blocked duct or whether it's mastitis. All
Can
right.
you explain what mastitis is, or mastalgia is?
Yeah. So mastalgia is the term for breast pain. And that encompasses engorgement, a blocked duct, a breast abscess, or mastitis. So mastitis can present very similarly to engorgement or blocked duct. It's just that the mum ends up feeling ill with it. So rather than just the local pain, is also that they're feverish and they're unwell, and it's an infection. So they will inevitably need a course of antibiotics. However, physiotherapy treatment was actually devised to stop women from overusing antibiotic treatment. Because obviously, if you go to a doctor with breast pain that's red and it's engorged and it's looking rather nasty, they'll just immediately say, well, you need to take antibiotics. If you haven't got an infection, that's not going to help. So it's really a case of trying to educate people as to whether they need antibiotics or not. So a treatment, someone would come in, we would obviously have a feel of where the blockage is. If it's engorgement, it will be the whole breast. If it's a blocked duct, caught early, it'll probably just be one area where we will feel a lump or a swelling. And what we educate women in breast pain is that where the pain is not necessarily where the blockage is, not necessarily the blockage that you're feeling. It's actually the fact that the blockage has caused the milk to seep into the breast tissue and cause an irritation, inflammation.
Right.
So treatment is physio treatment. A lactation consultant would actively try to unblock. And a physio treatment is much more about the lymphatic drainage of that. So we're removing inflammation. Like with anything that we do in physiotherapy, we want to remove inflammation, irritation within the body and make things work more optimally. So the idea is that we educate women when they need to do this massage. It's very simple, it's not difficult, and how to help themselves. So we'll do the massage techniques, teaching them the massage techniques, which is opposite to what a lactation consultant would do, as I've just mentioned. And then we will do ultrasound, so an ultrasound therapy, so a very, very high dose of ultrasound therapy for about 20 minutes. And then we can actually use some kinesio tape placed on the breast to lift that top layer of the skin, which will help then the lymphatic system to work more effectively for longer periods of time through that day. A lactating breast is very dynamic from hour to hour. It changes, right? So the physio treatment may last and work while it's happening, but then we encourage the woman to either feed or pump directly afterwards. But then what happens the next hour? All right. So we then usually would see people sort of quite closely in succession for hopefully only a 3-day period, maybe 2 days if it's responded really well. And that's generally how we treat breast pain. we keep an eye on the ladies if we think it may be, they've come in early and we're not sure if it's mastalgia, they're not feeling necessarily ill, but hopefully the treatment will knock it on the head and maybe actually stop them from needing the antibiotic treatment.
So would you say that the not the cutoff point, but sort of like the limit would be like if they are having the pain but not feverish yet, then they can still come and see a
Absolutely. I mean,
lactation pain specialist.
yeah,
But
yeah,
if they are having the fever, possibly better to go see the doctor first, or still get to see.
well, you can always go and see the doctor, get the antibiotics, see the physio at the same, that day.
Mhm.
It's my breast pain patients are my absolute priority on the booking list. If I'm full, I'll be like, and they've called and they've got a problem, I was like, we need to get them in today.
Mm.
Because obviously by tomorrow or by 2 days down the line, they've just had 24, 48 hours of really excruciating pain and a baby that needs to be fed.
Yeah. Okay. And so also with physiotherapy, is there any limitations to physiotherapy in terms of like when is the, I guess, where's the cutoff point in, okay, let's go back in time. When should if a person's just feeling any type of pain, should they go straight and see a physiotherapist, or should they get a massage treatment first just to like release, and then if the pain is persisting, that's when they would want to go see a physical, is it a physical therapist and a physiotherapist the same, by the way?
Yes, yeah.
Okay.
So physiotherapy is physical therapist is what they call in America.
Right.
We're the same
Okay.
profession.
Okay. But so if they've done the sort of like, if they've had pain, and then obviously if it's not like the sprained ankle, but let's say that they're having so it's not caused by some sort of event trauma, but they're just having pain in general, when would you say that's when they should probably consider a physiotherapist?
So obviously previous personal experience will direct someone to seeing whoever they have in the past has helped them. Some people will go to acupuncture.
Yeah.
Some people will, before they even go to a GP, they'll go to a massage therapist. They'll go to their chiro. They'll go to their osteo. It's all about previous experiences. But I think from people coming in for physiotherapy and our limitations as to how we can help them, really is about getting a very, very thorough assessment and history of their pain. So what we are looking for as physiotherapists are any red flags, that we don't, maybe there's a fracture somewhere in their body, or something more nasty that's going on that really needs to be investigated. So, which then we would then refer them onto their GP to get a referral onto a specialist.
Right.
I don't know if
Okay.
I've really answered your question there,
No,
but
kind of. Yeah. I mean,
um,
if you could then, would you know then what's the difference between if a person is trying to see an osteopath, a chiro, and a physiotherapist? Like, when would they choose to see a physio over the chiro, the osteo? When would they be seeing that? I mean, because obviously you're not an osteopath or a chiro, but you would know people that are, and your patients would have seen them. So,
yeah, absolutely.
yeah.
So all these professions strive for the same goal, right? So I mean, to take a patient's pain and symptoms away is all of that's why we do what we do, and we want to make them feel better. I would also say that any therapist that is truly great at what they do and has a patient's interests at heart is going to be effective. However, our approaches do vary. The treatment approaches do vary. So I think, I mean, again, I can only really speak for physiotherapy and our approach at Physiomotion. But as I said, an accurate diagnosis with a deep understanding of the underlying mechanisms of what the patient is experiencing is very important. So, and again, I think we would want to fully understand the mechanisms, and as with any therapist, we're not going to sort of dive in without knowing. I would hope that all the professions, stand by these very high standard of rules and levels of treatment that we want to withstand for our patients and get the best results for the patient.
And
Yeah.
do you think physiotherapists in general, sort of like, I would imagine that the training, as you said, it is certified. It is very strictly, regimented in terms of assessments and stuff of people getting certified as physiotherapists. But obviously, there's so many physiotherapists out there, right? So,
Yeah.
how do people? What would your advice be to if you were in the client's shoes, like choosing the right physiotherapist?
Well, again, obviously, as I said, physiotherapy is a licensed profession, and it's recognized by the medical profession as being a scientifically based treatment model. We work both in private clinics and throughout the community, in hospitals, in rehab centers, sports centers, just to name a few. So you could say that physiotherapy is significantly more present, maybe, throughout the healthcare landscape, as a possible go-to. I don't know. I am a physiotherapist, so obviously it's difficult to say how many people go to a chiro over a physio over an osteo. But I think that generally what we are looking for as a healthcare provider throughout those three disciplines, all those disciplines out there, massage therapy, throw that one into as well. PTs, we want the best for our patients. So really what it comes down to is again, what the patient has experienced previously, and what works for their body. I mean, as I've said before, people might go straight to an acupuncturist.
Yeah.
Because it's worked and they believe in it, and that 100% is really important as well.
Yeah. So as you said, it's basically really comes down to the person and the conditions. And usually most people are also kind of referred by doctors as well, right? Is that how the system works? Can someone just walk into a physiotherapy clinic?
They can do. They can just walk into a physiotherapy clinic. We are not autonomous from the doctors. And also with many people with medical insurance, they will often, in order to be covered by their medical insurance, they need to have a doctor's referral.
Okay, so good to know.
Generally how it works.
Yeah, okay. And then if we could just like end off in terms of, Mel, what is the shift that you want to create with the work that you do?
The shift. Well, I think I've said it all before. I mean, I think, any great therapist strives to make their patient feel better, all right, and be able to function in life, whatever their lives requires of them. Every individual is very different, so it's really important to look at what is necessary from a treatment point of view. Are we getting this person back to playing professional netball? Are we getting this patient back to being a mum? Are we getting this patient just to be able to sit at their desk at home and be productive in their day, and not their thoughts just be sort of overridden by pain or discomfort? So our goals are always about what is best for that individual.
Yeah, and I think that's really important for people listening and watching as well, is that each person's body uniquely moves for its own body. Yeah, so the next, for me to my own husband, very different. From me to Mel, very, very different. Our bodies like the function of a body is the same. Your head has a sense of your shoulders and top of your chest and everything, but the
Yes.
movement is very different because we're all built differently. So yeah.
Life throws different things at all of us.
Exactly. We have different movement patterns, different things in our lives, different activities that we all do. So try not to ever compare, especially for new moms. And I think this is what my thing is really about physiotherapy and having this podcast, is that I want new moms to understand that just because your friend XYZ had the same pain, but then it went away and they didn't have to see a physiotherapist, does not mean that, it might be the same for you. Or, like, to each their own, is to definitely get the help that you think you need, and not think, I'll just brave through things. And
pain is not normal.
yes.
The message. There's that's something in your body that's crying out for some help somewhere along the line.
Yeah, absolutely. And I think that's really, really important for people to understand, yes, that pain is a message.
It's not a weakness to seek help for it as well. As you're talking about new mums as well, we offer antenatal classes. with one of the GP practices. And what the main message that I always want to come through with that is the importance of empowering a woman with knowledge that after a pregnancy, their body will be different. And there are taboo issues like urinary incontinence that we see on a daily basis in a physiotherapy clinic. And don't be ashamed by seeking help for that. And the pelvic floor is just like any other muscle in our body, and it has a nerve function. It has a blood supply and a nerve supply that we as physiotherapists can treat and make better. So from that point of view, if you're talking about those new mums out there that their bodies have all of a sudden changed, and you can make that better again. Absolutely, 100%. It's not normal to leak continuously after you've had a child, and it shouldn't be accepted as the new norm.
Yeah. Yeah, there's always hope out there for sure, and always answers. So definitely for new moms listening and watching and everything, please definitely go and see your licensed healthcare provider. I hope this kind of conversations help point you in the right direction and give you some answers to some of the questions that you might be seeking. So on that note, I just really want to thank Mel for joining us today to talk all about physiotherapy. Thank you so much, Mel, for coming in from Hong Kong. Well, tuning in from Hong Kong.
Thank you for having me. It's been great to chat.
Yeah, it's been really good, and I hope you guys enjoy this conversation, and thank you so much for tuning in.